I am Dr. Janelle St. Louis, the Director of Health and Wellness here at SCBC. Our health observance for the month of May is Stroke Awareness. Today, I will empower you to save lives and reduce disability by teaching our congregation at SCBC to be Stoke Smart. You are going to learn to recognize the signs of a stroke and be confident and call 911 when you spot a stroke. Many emergencies are obvious, such as a bad accident, someone choking, or someone who had a heart attack. And in these situations, we recognize the immediate need to call 911 or otherwise intervene. With the brain damage that accompanies a stroke, the emergency can be less obvious, but is every bit as serious. Someone in the U.S. suffers a stroke every 40 seconds. Although highly effective treatments exist, which may leave a stroke patient with no deficits, too many of us do not recognize the signs and symptoms of stroke in time to benefit from interventions. 2 million brain cells die every minute during a stroke. Treatment must begin with just a few hours after symptoms begin. The best outcomes are treatments that occur for people who arrive at the appropriate hospital immediately after symptoms begin. Many people call their primary care physician for help first, or lie down thinking their symptoms will go away. The key to minimizing brain damage from stroke is calling 911 immediately. Not all hospitals can administer treatment. EMS personnel know which hospital can treat you and get you there quickly. Strokes are the #1 cause of leading disability and the leading cause of death. 1 in 6 of us will suffer a stroke. Anyone at any age can have a stroke. A stroke occurs when blood flow to the brain is interrupted. One way flow can be interrupted is from a clogged blood vessel. When the blood vessels that continuously nourish brain tissue become clogged, brain damage begins and a stroke occurs. The easiest way to remember the signs of a stroke is to remember FASTER. F is for face, drooping or numbness on one side of the face. An uneven smile is a sign of a stroke. A is for arm, weakness or numbness in one arm. Ask the person to raise both arms. One drifting downward is a sign of a stroke. Stability, difficulty keeping balance, trouble walking, loss of coordination. Have the person close their eyes and try to touch the tip of their nose with their finger. T is for talking, slurred speech, inability to talk, hard time being understood, are all signs of a stroke. The person should be able to repeat a simple sentence like, "The sky is blue." E is for eyes, difficulty seeing out of one eye, difficulty looking at one side of a room, or double vision. R is for react. If someone shows signs of a stroke, call 911 immediately. Remember, when symptoms first appeared, this will help doctors determine if a person can receive the life-saving medication to help reverse the effects of a stroke. Depending on the part of the brain being deprived of blood flow, signs will vary. People suffering strokes don't necessarily have all or even several of these sudden signs. Just one of the signs, even if it comes and goes, is enough to suggest brain damage from a stroke. This training is accompanied by a Stoke Smart wallet card and magnet that reminds you to call 911 when you spot a stroke. Teach those around you to recognize the signs of a stroke and call 911 when they spot a stroke. Be a stroke champion and teach this knowledge forward. The key to surviving a stroke and to recovering quickly is recognizing the signs and acting immediately. Thank you.